This short recording is taken from a presentation that I gave at the American Society for Dermatopathology meeting in San Diego in 2019. I wanted just to focus for a short while on the blastomycosis reaction pattern. And this is defined as a lesion where one sees hyperkeratosis, very marked epithelial hyperplasia, which sometimes may amount to a pseudoepitheliomatous pattern. And then within the dermis, one sees numerous abscesses in association with giant cells and granulomata. Sometimes these inflammatory changes may be seen within the epidermis itself. And when you look at this type of histology, there are a variety of diseases which should come to your mind. Most cases, maybe 95% of cases, will be of an infectious nature. Fungal infections are probably the most common, after which you may see occasionally mycobacteria, as for example in warty tuberculosis, or in scrofuloderma, and sometimes atypical mycobacterial infections, particularly in the immunosuppressed, may show a blastomycosis reaction pattern. Bromoderma is sometimes a cause, and we mustn't forget that occasionally artifact may even result in this appearance. Superficial granulomatous pyoderma I'll come to a little bit later on, and blastomycosis like pyoderma is a disease which occurs in the malnourished and extremely ill patients. They're often diabetic or alcoholic, and it represents a very unusual reaction pattern to a chronic infection, sometimes due to staph or E. coli, but many other organisms may be involved. So this first case that I'm showing is indeed blastomycosis, and you can see this most easily in the bottom left-hand picture, where yeast forms are showing a very thick cell wall, and they're undergoing broad-based budding. And if you look very carefully at the cell, you can see that there are multiple nuclei. So thick cell wall, multiple nuclei, and broad-based budding, those are the features that help define blastomycosis. Now, it depends where you are. If you live in the territory, if you like, of the Mississippi River, the Ohio River, the Great Lakes, and you see this reaction pattern and these organisms, then you can be pretty sure it's blastomycosis. But other fungal infections can be very, very similar, one of which is, and I'll show you it later, is paracoccidioidomycosis, which occurs particularly in Brazil. It used to be known as South American blastomycosis, and morphologically they're very hard to tell apart unless you see sporulation in paracoccidioidomycosis, when it looks like a pilot's wheel. Sometimes blastomycosis-like reaction pattern can be due to phaeohyphomycosis. This is an infection which may occur in immunosuppressed patients, or as we see it more common in dermatopathology, it presents as a subcutaneous implantation cyst. And this lovely case shows it very, very beautifully. There are microabscesses, there's a rim of granulomatous inflammation, and in the bottom right picture you can see both hyphae and yeast forms. And these are other infections that may be associated with this histology. Coccidioidomycosis. This is a lovely example shared with me by Jill Cohen from Tucson in Arizona. Alternariosis I'll come to in a different video, but it's quite a difficult diagnosis to make because the organisms are often not terribly conspicuous and you may have to search for a long time. Zygomycosis has a very unique appearance. It's sometimes mistaken for mucor, but zygomycosis is not a vascular infection, and it has these very large twisted and irregular hyphae, as you see in the top right. Chromomycosis is a dead giveaway because there's nothing else that gives you these brown sclerotic bodies. In the middle bottom picture, there's a lovely ship's wheel courtesy of Geronimo Junior in the case of paracoccidioidomycosis. I wanted just to warn you, be careful when you see the asteroid type Splendor Hepli phenomenon surrounding a yeast form in an infection. There's a tendency to say, oh gosh, this is sporotrichosis. Under the right circumstances, it might well be, but other fungal infections can give identical appearances. It's quite interesting that one of the fungal organisms, Phyllophora, which causes phaeohyphomycosis, it can also form or cause chromomycosis, and it can also cause Majura foot. So it's sort of an interesting observation. Now, scrofuloderma is a form of tuberculosis in which an underlying lymph node or matted lymph nodes or perhaps joint infection points up to the surface, and so you get these very deep ulcers lined by granulomatous inflammation and some suppuration. This should be teeming with acid-fast bacilli. And then lastly, superficial granulomatous pyoderma. This case is very kindly shared with me by Professor Sate Hamza. It's a very rare condition. It was first described by Edward Wilson Jones. And patients develop furuncles, which then extend to form large ulcerated plaques, and predominantly they are found on the trunk. Lesions may follow pinprick. In other words, there is a pathergic reaction in patients. Although it's called superficial granulomatous pyoderma, implying a relationship with pyoderma gangrenosum, this is a little bit uncertain because superficial granulomatous pyoderma generally responds very well to treatment and is not associated with any underlying systemic diseases. If you get a really nice example, you'll often see a zonation pattern where there's pus in the center, and this is surrounded by a rim of granulomatous inflammation. And then outside that again, you'll see plasma cells and eosinophils, but it doesn't always show that classical appearance. So in conclusion, the blastomycosis reaction pattern is almost always a response to infection. The vast majority are associated with fungal infections, and if you look carefully with the H&E, you will often find the offending organism.